Hi, everybody. Welcome. Just give us about 1 minute. We're waiting for one last panelist to dial in, and we'll get started on today's discussion.
Hey, Dave's here.
Ah, Dave, there you are.
Hey, Dave. There we go.
Hi, Dave.
Oh, I like that background, Tom. If you tell me you're really on a beach.
No, unfortunately, no. Unfortunately, no. My wife think it shows my my gray hair nice. It's a nice backdrop.
It blends in.
Well, it's since I've had gray hair since I was 20. You know, I guess it.
Hey, I've got two members of my management team here in my office with me, Stephen Lovelace and Marlon Jones, both more competent than I. So,
Smart. Surround yourself with those more intelligent than yourself, right? Isn't that one of the rules?
Yes.
And welcome to everyone who's just dialing in. We're still loading the participants, and then we'll get started in just a few seconds.
So, Dave, Kathy, Jane, thank you. I was on the warm-up call, but for some reason my audio wasn't working. But I've had a chance to wanted to say thank you guys for participating. This is a good topic, and it's a long-term topic. We're just scratching the surface, I think, on this one.
All right, Tom, you ready to kick it off?
Sure.
Okay. Well, welcome everyone. This is All Hazards Consortium Business Resiliency Virtual Discussion Series. This is our second webinar that we're doing on logistics and how it's been affected since COVID-19. So welcome to all of you. If you have a moment to say hello through the chat box, let us know your name and where you're calling from. We'd love to see who's on the line. And I just wanted to introduce myself. I'm Laura Johnson. I'm the Director of Conferences and Events for the nonprofit organization All Hazards Consortium. A couple administrative remarks before we get started today. First, you've all been muted upon entry, but feel free to use that chat box as well as the Q&A feature to ask any questions or make any comments you have. Also, if you have any resources or solutions that you want to share with us today, feel free to go ahead and type it right in. Just want to say hello to Bruce Churchill. I see Bob Crow is back. Hey, Bob. Welcome to Tracy. We have Christopher Singh, Emergency Preparedness Security Manager at the Met. Nice. And a few bunch are more saying hi. We'll get to say hi in just a little bit. We are recording today's session, so we'll send you all a link after the webinar is over so that you can share that with your peers and your colleagues. And I just wanted to say hi to Tom Moran, who's our Executive Director. Tom?
Hi, Laura. Thank you, and welcome, everybody. We had planned to do a National Resilience Summit meeting in June, the first one, in our partnership with DHS, SISTA, and other federal agencies and states. And so with COVID, that got canceled. So we converted those to what we thought was going to be 4 or 5 webinars. And I think, Laura, I don't know how many we've just had overwhelming response on that. And it's really not us, it's the people that we've all partnered with over the years. And so I can tell you, everyone you're going to hear from today, personally, I've worked with for years. These are some of the best in the business, and we're certainly very active, not the only ones, but certainly very active in COVID. So we'll let the panelists introduce themselves, but I'm really glad you can all join us. During the call, you might hear a name mentioned, the SICE, the SISE. What is the SICE? The SICE was built by the private sector as a way to vet identities of people and validate data and bring them together in a safe environment that's free from FOIA requests and media requests and all that stuff, right? So that industry and government can plan and have honest conversations that get heated at times, but they all end up working to solve a solution. So if you hear about it, you mention it, you'll hear about it a little more in the call. You can register with it. It's no cost for that at siceusa.org. But this is how the private sector works to address problems, solve problems, and then make those solutions, if you will, line up with the people and keep that private for operational use only. So it doesn't handle secure, like top secure information, but a lot of times information is very sensitive in the private sector that isn't totally like top secret. So we do that as a respective way of managing the protocol there. So anyway, I'll turn it back over to Laura. Really glad you guys could join us. I'm really looking forward to today's call. This could be a good one. So go ahead, Laura.
Thanks, Tom. So as I mentioned, this is the second discussion that we're having that involves logistics. We had talked previously with American Association of Railroads and American Trucking Associations. And today I'm really happy to introduce Kathy Fulton, who's the Executive Director of ALAN, the American Logistics Aid Network. We also have Dave Lusk, who is the Director of Global Security Operations Center at FedEx. And we have Eugene Shearer, who's the Supply Chain Advisor at FEMA's Logistics Management Directorate. So welcome to today's panelists. And we're going to go through a series of about 5 or 6 questions, and then we'll have time at the end for the listeners' Q&A. So the first question we have today deals with the operational impacts. And if you could first introduce yourself and tell us a little bit about what you're doing at your group. And then if you could describe the operational impacts that COVID has had or is having on your agency or organization and the challenges you're facing. So Gene, if I can start with you.
Sure. Good afternoon. I'm Eugene Shearer. I'm the Supply Chain Advisor for FEMA Logistics Management Directorate. Been with the agency for about 2 years. They've been a very eventful and busy 2 years, as a matter of fact. And so today I want to talk a little bit about the operational impacts, as the question leads us to look at, of what FEMA had to deal with as far as the COVID response. And we got involved back in January when HHS was looking at COVID in China, and we were asked, FEMA was asked to come over to Health and Human Services and work with them in planning for the pandemic planning document and kind of look at how we would react to a pandemic if it occurred. At that time, we were hopeful that it would not, and we were watching China very carefully. The thing that I was focused on, and we were told to focus on China's export industry and the impacts with pharmaceuticals and all other things that we get from China. So we did a lot of detailed work in looking at their export capacity and how that would impact the U.S. because it had shut down, as you recall, for the Lunar New Year, and then it stayed shut down for an extended period of time. We helped HHS in planning, and at that time, HHS first started to look at personal protective equipment and the impacts that a pandemic, or just even if it stayed as an epidemic in China, what the impact on those would be, which we eventually saw were profound and were much worse than we originally thought because of the optimization of that industry. So in January and February, we did that. Then pretty much HHS was the lead agency. We were in support as FEMA. And then everything changed on March 13th when POTUS declared a national emergency. He put FEMA as the lead agency. HHS was in support at that point and activated all of the Stafford Act, our ability to manage the pandemic like any other disaster, but it definitely was like no other disaster that we had ever seen. And that leads me to talk a little bit about the operational impacts. So never before had FEMA or anyone else had all 50 states and all territories as declared disasters. So that was new. We've had multiple regions activated before in support of one disaster or another. We've had several activated, but never all 10 at once. So that was a huge drain on resources. And so we activated on the 13th and stayed activated for 91 straight days, 24/7 operations out of the National Response Coordination Center, the NRCC, there in FEMA headquarters, and at the same time had to call down as far as the number of people in the building, we went to probably about 30% capacity of what we would normally have, put everyone out on telework that didn't need to be in the building. I was one of the ones that had to be there. So I was there 4 or 5 times a week, and then telework the other time. So that was a huge impact. Also, some other things before we go to the next panelist here that we had to look at is we had never dealt with a lot of the stock keeping units that we had to look at. We had to start to manage testing type of supplies, all of the PPE that you've seen, gowns, masks, hand sanitizer, gloves, and the like. We don't normally manage those. So we had to manage the distribution of those and the prioritization. And a lot of you saw that on TV as we went through. But that was a huge operational impact. And then because, before I turn it over, because of the long-term 91-day of continuous 24/7, we had a lot of burnout going on. We had people that had to be rotated out along with positives there in the building, and had to do contact tracing and shut down whole floors at certain times and then bring them back, and eventually got pretty good at the sterilization at night of the whole building, along with a lot of the temperature testing, the questioning, and so forth. The social distancing went on the floor. So those are some of the operational impacts that FEMA had to deal with COVID.
Okay, Gene, thank you so much. Let's fast forward a little bit, Gene, if I may. Since we've been in this for a few months, what are the current operational challenges that you're dealing with? And you'd mentioned a 30% capacity. What are you working at now? And what are some of the newer or challenges that are still happening at your agency?
So that's a great question, Laura. So we have shifted back to HHS being in the lead. So now our headquarters is no longer activated at the 24/7 in the NRCC. We're down to basically a 10-hour day there. So that is still being manned in support of HHS. They're managing the continued testing and the social, the non-pharmaceutical interventions and everything that's taken place. So we have taken a step back and are now focused on regrouping, retooling, and getting ready for the hurricane season, which, as you know, started on 1 June. We've had several named storms already. A unique weather event off of Africa has favored us in that the dust storms that were coming off the Sahara have kind of kept down the formation of Atlantic hurricanes. There's still a good bit happening in the Pacific, including some that we're watching right now. But we're really trying to get back to our bread and butter and get ready for hurricanes. It's always earthquake season, of course, so we have to be ready for that all the time, and retool and get everybody back ready to go. Now, at the same time, a lot of the orders that we put in for PPE are still coming in. And one of the operational challenges is our distribution centers are overflowing, and we've had to go out and contract for additional warehousing capability to house some of the gowns and masks that have come in. And hopefully that's a good problem to have, and we don't get into a shortage event again in the fall or as things start to heat up again. But that's one thing that we're dealing with right now, and just trying to look at what a hurricane response will look like in the COVID environment. It's going to look a little different. We're going to have to make many different decisions. Congregate sheltering has to be modified so that there's social distancing. Congregate feeding is pretty much gone. So we're going to have meals that cannot be prepared in mass, but distributed. And those are some of the operational impacts that we are dealing with currently as we move forward through the hurricane season.
That's great, Gene. Thank you so much. Kathy, I'd love to get your perspective on how COVID has impacted your organization as an or organization as the Alon, but also the members that you have at your organization.
Yeah, so thanks, Laura, and I love hearing everything that Gene talks about, because it's very much mirrors a lot of the things that we saw with private sector partners. And I'm actually going to talk about kind of our internal operations, as you said, our business partners, but I also want to touch on some of what our nonprofit partners have been going through, because I think that sometimes people don't necessarily understand how much stress this has created for that social safety net that we have out there. So just, you know, Gene gave that kind of magic date, March 13th, when, you know, an emergency declaration was issued. We actually started working on this similar to what Gene said back in early January. I feel like those of us who work in the disaster space have really pretty much been activated since the beginning of the year when we had the Puerto Rico earthquakes, and we just haven't stopped, right? So for us as a virtual organization, there was actually very little that changed from an operational perspective. My board is all distributed across the nation. Our volunteers are distributed across the nation. We're very accustomed to working remotely. I do have an office. I haven't been to it in daytime hours or weekday daytime hours in 3.5, 4 months now. But from an internal operations perspective, the only thing that's changed is the pace, right? And the things that we're dealing with. And the reason for that is because of our business partners and our nonprofit partners. And so I want to talk just a little bit about I don't need to hit on what our business partners were experiencing. I think anybody who picks up a copy of whatever media piece you want to see understands the challenges that our supply chains have faced. I will say that since the first quarter of this year, I think everybody at least knows how to spell supply chain now. I think there's still a lot of misunderstanding about what it really means. But the businesses that have been affected by it, I don't think that anyone who tried to buy toilet paper in March has any confusion about what it means, what supply chains really mean. So, you know, we support that community with information and resources and expertise. So we're supporting them, helping convene them, bring them together, and help them problem solve. And that's an ongoing thing. So you talk about the current challenges. That currency of information, you know, a lot of the challenges very early on had to do with guidance documents. There were no guidance documents, right? So helping a truck driver or a warehouse operator understand how do you protect your employees when you're accustomed to handling paper and shuffling paper back and forth. So helping them at least convene to talk about practices and share those practices. I do want to, I mentioned I want to talk about the nonprofit side because, again, I think that the strain that perhaps the food banks are under has been very visible, right? People have seen the pictures of the long lines for people waiting for food. With the number of Americans out of work right now, just the stress on the food banks has been exceptional. I want you to also think about where they're getting their resources from, though. It's from the private sector. Either they are purchasing or they're getting donations. So as the economy contracted and we had all of these challenges with stress in private sector supply chains, that also stressed the nonprofit supply chains, perhaps even more so because their sources, their supply was diminished. So you have a demand crunch because a huge increase, a supply decrease. And as someone I talked to this morning described it, it was a perfect storm. And, you know, we can say that about a lot of things. When you also think about the nonprofits and how they operate with need for volunteers, you can't do that in this situation, right? You can't, and most volunteers are elderly. So increased need for support for logistics, specifically automation, that puts an increase on us to help find those resources for those partners. So that's a lot of what we, we've been activated all year. As I said, I feel like I never stopped from Hurricane Dorian last year. Those are kind of the operational impacts that we have. It's just the constant pace and the constant requests that we continue to get.
Okay, Kathy, thank you so much. That was a really excellent answer. So now I'd like to introduce Dave and your gang. We have a couple of co-workers with you today. If you could tell us a little bit about yourself, Dave, and how the pandemic has affected FedEx. Oh, you're still on mute, Dave.
There, can you hear me okay?
Yeah, you're good.
Okay, great. Hey, I appreciate the opportunity to participate with my team members. It seems I'm always following Kathy on these. So thank you for teeing the ball up for me, Kathy. I admire the work that she does and her team. We've built a partnership and exchanged business cards a number of years ago at a public-private sector partnership organization. Now, that is certainly the time to exchange business cards well before you need them. I have been with FedEx for 32 years. I came over in 1989 with an airline that FedEx bought called Flying Tigers. So I've been in logistics virtually my entire career. I recently, in November, changed over from the airline operations control side to the Global Security Operations Center that I've been tasked along with my management team to stand this organization up and expand into some new mission sets to protect the enterprise. But I got to keep the disaster hat and brought it with me over with a project we call North Star. For most of you know the courier, what FedEx is for you is the person that picks up and delivers your packages, or FedEx Office. But FedEx Enterprise is comprised of FedEx Express, time-definite overnight shipments, FedEx Ground, which, mostly e-commerce deliveries through FedEx Ground, FedEx Office, that's the storefront for FedEx, FedEx Freight, which is less than truckload, business to business, FedEx Trade Networks, logistics, supply chain, for container shipping, managing supply chains, you name it. So we serve 220 countries around the world. So in essence, we're always operating with our hair on fire. We've got a fleet of over 670 aircraft, so they're in constant motion 24/7. Just the aircraft, not to mention the over 40,000 vehicles we have in the U.S. and then global vehicles we have every footprint around the world. So to cut the chase here on operational impacts, we have been operating at Christmas volume levels since January. Now, for us, peak each year for us was normally between Thanksgiving and Christmas Day. We have been operating at those volumes and above those volumes since the beginning of January. Mostly with people sheltering in place, there was a massive increase in e-commerce, shipping from a supplier to residents, to consumers, not to mention the massive demand on global movement of personal protection equipment. What that has done for us is if we have an aircraft with one wing and an engine, we're flying it. We're operating a significant number of charters. That's whole aircraft. Basically, a customer purchases the volume on an entire aircraft. So we've been running close to about 20 of those per week from between all points on the globe, as well as significant additional lift we are providing for the United States Postal Service. We are the primary airlift provider for priority mail. So in most cases, if you're sending something outside of your metropolitan area to somewhere else in the country, it's going to move on a FedEx jet on the day side. So there's been significant demand there. Along with our regular business, we maintain sustainable relationships with our disaster relief partners. Those are Direct Relief, Doctors Without Borders, Salvation Army, Red Cross, International Medical Corps. So we have been maintaining those, the movement of their supply chains as well. One other area that we got significantly involved in, and it began really in the week after Christmas, we began to see an outbreak of a virus in China. We have a 200-person call center in Wuhan. So we have been dealing with COVID since right after Christmas, and addressing the initial demand for PPE to protect FedEx team members in the Asia Pacific region and all of those countries, as well as to protect our customers, and moving supply intra-region, but also moving some initial pandemic influenza PPE material that we had already in our possession here in our headquarters in Memphis. Not enough to provide for every team member globally, but we wanted an initial cache that we put in place after H1N1. So we had that in warehouses here. We distributed it or pushed it out into our Asia Pacific theater to initially supply those team members. And then, like everybody else, we rushed to backfill the significant need as we've had. So I will add that it's kind of interesting. Timing plays in everything. I looked at my calendar, and back on December 9th, we had the ASPR secretary, Dr. Cadlick, was here in Memphis and met with our chairman and some of my peer directors to talk about innovation and how ASPR could innovate in a little bit different way. Now, FedEx has been an SNS, Strategic National Stockpile contractor, ever since its inception. So we have been involved in maintaining the SNS supply or sending it to warehouses, but also in mobilizing it during exercises as well. So we're in this up to our eyeballs.
I can see what you mean by your hair being on fire. That's crazy. And I don't think it's going out anytime soon. So Dave, would you say that your air fleet increased during COVID, stayed about the same, or?
Oh no, it increased dramatically. And not only do we have to maintain that movement of the increased volume, but we also had to deal with, as well as a lot of businesses here in the United States and elsewhere, had to deal with social unrest issues in the recent past months. We had some locations that were impacted by that. We had some metropolitan areas that were impacted by that. I did get calls from individuals that I had exchanged business cards with over the years at the PPP conferences, asking for information on, hey, is it true FedEx is not delivering to this particular zip code where a particular hospital was located? And in some cases it was true, to protect our team members due to events that were taking place. Now, while all this is occurring, I'm sure with everybody else on this call, we had an approaching hurricane season. So every year in April, we stand up a pre-season hurricane call to make sure all FedEx team members in hurricane-prone locations in the Southeast, and actually I'd go from Boston all the way to the Mexican border and also the Southwest United States and Hawaii, that those team members are reviewing best practices and communications procedures and protocols for hurricane season.
Yeah. All right, Dave, thank you so much. We're going to move on to our second question, which deals with how we've addressed those challenges. So, Gene, I'd like to start with you again, if I may. How has FEMA addressed the operational issues that the pandemic has caused your agency, and what initiatives have you taken?
Yeah, so I appreciate that question, Laura. A couple key things I'd like to highlight. Many people have probably heard or seen the Supply Chain Task Force, which is really a misnomer. It formed underneath FEMA in partnership with the Department of Defense. Admiral Polovchek leads that, and then we have a lot of FEMA people that work in it. And although it's called the Supply Chain Task Force, it's really the PPE Task Force. So what we did early on, because PPE and medical pharmaceutical goods and the like were being managed by HHS, and FEMA was mainly focused with all other and looking at where key things would be a problem. The PPE Task Force was stood up. And they really have three main objectives: the preservation of PPE, the managing demand, if you will, making sure that the proper level of masks or gowns are being used for the proper thing, so that you're not over. Like, you may see people walking around with respirators on when they could be using a cloth mask. Well, that's a waste of PPE, and that makes the problems even worse in a lot of cases. Accelerating, and I'm going to get into this one a little bit more, and I think Dave talked about this, but the acceleration of deliveries. And I'm going to talk a little bit about the air bridge after I talk about the last objective for the Supply Chain Task Force, and that was expansion of capability. So you saw the federal government get directly involved with, some people say too much so, some people say not enough, but with the private sector in the manufacturing, the expansion of capacity and capability to manufacture everything from, the hand sanitizers all the way up to respirators. So you saw a lot of things involved. You saw threats of the Defense Production Act that caused people to do things. So those were the three main areas: preservation, acceleration, expansion. I'm going to talk more in detail about acceleration. And one of the very unique things that we did, FEMA, and it wasn't just FEMA's idea. This came directly from the White House in a lot of cases, was to fly planes to China and other places, Vietnam, Indonesia, India in some cases, and to move pre-ordered materials and PPE for the 6 major distributors back to the United States, and then allow them to distribute that in accordance with what their orders that they had for 50%, and then FEMA and the government directed where the others were going to. So, you had hotspots in New York City, everyone knows, in Seattle, and so forth. So the acceleration of those movements, what we really did is the government wasn't buying the PPE, we were buying the planes. And we were booking the planes to move them, to accelerate that delivery, if you will, as opposed to it going by container ship out of Shanghai or whatever port it was going to go to, and possibly taking, up to 2 or 3 weeks to get here. That accelerated a delivery a lot, and there's metrics that show how that worked. A couple other things that were initiatives and innovations, actually goes to both of them. So I manage the Supply Chain Analysis Network, and so this was the first time that this group of supply chain experts had to look at how we would address a nationwide crisis. And so a little bit different than what you have in a hurricane, where you have several different things occurring at once. The main thing that we ended up focusing on was the food supply chain and consumer packaged goods. And everyone can attest that have experienced the good and bad of that. But I would say that for the most part, hunger is not any worse than it was. Kathy did highlight the unique nature of the food banks, and we did take some initiatives at the federal level to provide money directly to food banks to purchase food where they were not getting donations. So it's definitely not perfect. It wasn't perfect, but those were some of the initiatives that we took to try to accelerate the delivery of PPE, to accelerate production and expansion, and also to help and manage the food supply chain and consumer packaged goods, which we saw as one of the main threats to the overall society as we went through COVID.
All right, Gene, thank you so much. Great answer. Hey, Dave, we're going to jump to you so you can say that you don't always go behind Kathy. So how would you answer this question? What initiatives has FedEx taken to deal with the issues that you've had?
So my choice is to follow Gene now?
I'll put you first next time, okay?
Yeah, so initiatives. About a little over 15 years ago, as I mentioned, H1N1, we've dealt with swine flu. It was inevitable we were all going to be dealing with this event. It was not a matter of if, but when. So we took what at the time was a 4-inch thick pandemic plan, threw it in the trash can because it was not manageable, and we created found a consultant to assist us in building our corporate enterprise pandemic and influenza response plan. And we didn't make the mistake we made on the initial plan. We built a plan that was lean and in line with our corporate culture, which is very thin in terms of volume. Just got to the point to let us focus on what we had control over. So we found a very competent consultant that still works with us on a weekly basis as we continue to go through the COVID event. So we put those plans together to protect FedEx team members. We implemented that plan back in December, as I mentioned, and again, have calls on a weekly basis to assess where are we along the lifeline of this, which is going to go for a number of years in my view. We took some learnings that we gained from managing the event in Asia Pacific region and applied those lessons to the other regions in the world as we rolled out our pandemic plan. There's some things we've changed, some things that we have not, because it's worked very well. We are at the point now where we are, about 2 weeks ago, we rolled out testing in-house throughout the FedEx enterprise at major population locations, and we're going to leverage that process we put in place to use once a vaccine becomes available. So we're building upon what we have laid out in terms of a foundation for this response plan. What we have dealt with, and very frustrating, has been the very wide and different entry requirements globally. As I mentioned, we're flying to 220 countries around the world, and every country had its processes and its little idiosyncrasies of what you could bring into the country, what you could take back out, and what testing had to occur for FedEx team members that were going back into the countries. And I'm talking about our crew members. One can only re-enter a country so many times and have the infamous brain probe take a left turn once you get to your upper sinus cavity. So we had crew members, team members that were going through that maybe 2 or 3 times a week as they would fly out of our hub in China and then back into China. That's a re-entry. We ran into issues which most of you are probably familiar with, the quality of PPE coming out of certain locations around the world. And those origin countries were put in place quality control measures on the fly to maintain the integrity, if you will, and the quality of PPE that was being sourced out of those countries. So there were a couple of occasions where we were operating either an air bridge, which Gene talked about a little while ago, or a FedEx charter for a private customer or a state for PPE. We would position the aircraft all the way to China to fly a load out, only to have no product show up at the ramp to be moved on that aircraft because it needed a QN number or a Q number from some authority in China. So that sort of thing goes on in global commerce on a pretty much a daily basis anyway. So that's just a cultural side of global logistics. It just became more numerous with the increased demand and moving product globally. One of the things that we are continually, and we started talking about this back in March as we were in our third month of this, is for all FedEx management, members of management and FedEx team members to constantly be on the watch for fatigue. What comes from fatigue, what usually results with fatigue is complacency. And I can speak on the aviation side of business, that can cause significant issues in operating aircraft. Crew fatigue can cause issues. And we knew we'd see the same sort of human factor issues as we continue to deal with this long-term haul that we're all on together. It's, we need to constantly be aware of fatigue. We're seeing it in the public here in the United States now. People are tired, they're not wearing masks, they're not in compliance, there's nobody to hold them accountable, and that again results in complacency, and with complacency comes increased infections. So we're continuing to talk about that on a daily basis within the business to ensure we are maintaining as much control over our own destiny as possible.
That's awesome, Dave. I have a question about how you managed all of the data that you needed to know about sending your staff to different countries for entry or re-entry. Do you work through a portal? Like, how does that work at FedEx?
Well, it's an everyday part of our business. Anyway, we're operating.
It changes probably hourly, right, or daily at least.
Well, it has stabilized in the past couple of months, as everyone's gained familiarity with what they need to watch for, what they need to protect for. But, in our normal business, you've got countries that are changing policy, procedure, reentry requirements on a constant basis. So it's something we were very used to working with.
Okay, great. All right, Kathy, what about Alan?
Yeah, so a lot of the challenges that Dave talked about on the international side, the U.S. domestic ground carriers that we work with and ground logistics providers, we're dealing with those same challenges. I have an email somewhere that's just saved that I sent to a few of our state partners very early on, probably even February, that said, asymmetric applications of non-pharmaceutical interventions are going to crash your supply chains. And thankfully, I was not right about that. We managed through it, but there were moments in time where all of the different policies, the asymmetric application of those policies, really was causing a lot of friction within our supply chains. So one of the things that we took the initiative to do, and this probably falls under innovation, and I know Eugene talked about some innovation things as well, is we set up what's called our Supply Chain Intelligence Center. And it's basically a map, and I know that DHS has a similar map to ours. I just dropped the link into the chat. But that intelligence center was tracking the non-pharmaceutical interventions. It's still up. It tracks the masking requirements. It tracks we were tracking open checkpoints. The checkpoints. I live in Florida. The checkpoints coming into Florida. What's the status of those? We're pivoting with that, right? We knew that we always wanted something like this. It's multi-purpose. So as we move towards more weather-based events, we have weather initiatives or weather activity on that map. And the great thing about it, in addition to businesses being able to look and see what's affecting them within their state or what's at the county level, they can also look at shared infrastructure. So ports and airports, you know, ATRI, the Transportation Research Initiative, I'm saying that wrong, ATRI, has a top 100 bottlenecks for ground transportation across the country. We've mapped those. We're starting to add the traffic cameras around those top 100 bottlenecks. I had someone email me this morning that said, hey, we had all these terrible thunderstorms in our region. Our hub managers were able to go, they were able to look at it, they were able to see when to dispatch the trucks because it tells you over time what the risk is going to be for a certain region. They knew when they could dispatch their trucks, when it was going to be safe, when the winds were going to be high and the weather was going to be high. So I'm really proud of that particular initiative that we undertook. And that was really something to ensure that the continuity of freight flow continued despite whatever else was happening, either from a policy or weather or whatever other disruptive event may be out there. So I'll pause there. I know we're running short on time, Laura.
All right, Kathy, we're good. And as Kathy mentioned, she did put the URL in the chat box for our listeners today. Make sure you're checking that out. Some good information there so far. Okay, Dave, guess what? You'll get to go first on this question. So now we're going to address partnerships. So Dave, if you can tell us about some key partnerships that you already had in place and how to utilize, or new ones that you had to make in order to meet your needs through FedEx.
Okay, well, I'm looking at partners on the screen right now, so that goes without saying. I'll try and be very brief here, but first of all, the National Business Emergency Ops Center, you know, those folks I've exchanged business cards with over the years. An organization I joined this past year was the Security Executive Council for security organizations. And then our FedEx Cares initiative, we partner with a number of organizations, Direct Relief, International Medical Corps, as I mentioned, Salvation Army, Red Cross, et cetera. So those organizations, it's critical in our business that for us to give to the community, it's critical for us to build partnerships with the people that have boots on the ground. You know, it's okay to move at one location or another, but you got to distribute it the last mile. And that's where partnering with those organizations has been a tremendous boost and force multiplier for us in giving back to the communities that we live and operate in.
All right, Dave, thanks so much. Gene, I'm going to jump to you. Any partnerships that surprised you, either people that you reached out to or people that reached out to you?
Well, yeah, I think I mentioned before, Laura, about because of the Air Bridge initiative. I mean, we had representatives from the major pharmaceutical distributors in the headquarters with us. So we had their supply chain people working hand in hand with our transportation people, and probably reaching out to Dave at times also as part of that Air Bridge. I would say that, well, CISA, of course, CISA, we've with ESF 14, we've started working very closely with them. This because of the nature of the food banks, the grocery stores, USDA and FDA, we got very tight with them, and we always have a good relationship with them. But it was, you know, daily calls and daily interaction. So I think that was interesting. For me personally, I think probably one of the most rewarding relationships that I had is in Seattle and also in New York City is, you know, if not daily, at least multiple times a week, direct calls with the emergency managers for those cities and interacting with them and seeing what was really going on down on the ground, what the mayors were doing, how the mayors were interacting with the governors, and then feeding that back to the regions to make sure that our regions were in lockstep with those two major areas. I'd say that was probably the most rewarding. And I just had a call with the Ira Tannenbaum the other day from New York City to talk about next steps. So definitely that was most rewarding. But I think that just in the federal community, just getting a lot closer because you had to work. I mean, it was so desperate at times that you literally were on the phone with them multiple times in a day. So I'd say that was probably the most surprising.
Yeah. All right, Jean. Hey, Kathy, what about you?
Yeah, so Allen is in and of itself a partnership organization. We were actually formed by industry right after Hurricane Katrina. So we are formed of 30 plus supply chain and logistics professional and industry associations. So, you know, we've never had need to exercise those partnerships as closely as we have over the past several months. And what that means is not daily, probably daily interactions, but weekly calls with that group. And the great thing about it is we're not solving problems for them. We're simply giving them a platform. They're solving problems together. So you have people from all components of the supply chain. We have the trucking associations. We have warehousing associations. We have people who deal specifically with equipment. They all have common problems, right? Someone mentioned earlier in the call about having gone to all remote work, or I guess it was Gene saying, you know, only 30% staffing. Well, you can't do that in a warehouse, right? Logistics is a very physical activity. And so figuring out this group since March has been figuring out how to work through the challenges brought on by either the virus or the non-pharmaceutical intervention. And they've been sharing information with each other. That information then gets propagated out to their members. So literally hundreds of thousands of businesses are taking advantage of this shared information, these shared practices, so that they can propagate literally across supply chains. That group has also been very important in our conversations with our public sector partners, being able to say, these are the challenges we're having with this particular policy, or, here's some information that will help government better make decisions about what's going on. So using them is kind of a sentinel network a little bit to understand early challenges. And I think that's the key thing about partnerships is it's not just at time of crisis. It's an ongoing conversation. And we're proud that we've teed up conversations and teed up relationships that between those organizations may not have existed before, but are now in existence and strengthened because of that shared battle mentality.
Excellent point, Kathy. Thanks for sharing that with everybody. Okay, so we talked a little bit about innovations, but want to spend a little bit of time on this slide because this is what it's all about, right? Sharing solutions with our listeners and our listeners sharing solutions with us on how we can develop a more resilient service for our customers, our stakeholders, our members. So Jean, if I can start with you on this question, and you can share any innovations or solutions that you want to share with our listeners.
Yeah, and I think I covered that a little bit, Laura, in the previous in the previous discussion. I think one thing, and I think that Kathy probably hit on this a little bit, but as we tried to look at the national level supply chain, we kept getting drawn back to the national freight flows, and kind of as the lifeblood of supply chains moving across the United States and measuring how flows and where things were not flowing, some of the key areas of concern where non-pharmaceutical interventions may be causing issues. For instance, the closure of truck stations and truck stops, or even if you not only just, if you don't close them, if they still can get fuel, but there's no place for truckers to get food in their major routes, we started to see that measuring freight flows and monitoring how non-pharmaceutical interventions were affecting those flows. And as Kathy used the asymmetric application of those, you may have one state that was very much in tune, and one governor was very much in tune that the truckers were key and essential workers, and they needed to flow through, if not just to supply their state, maybe to flow through their state to go to another state. A lot of the supplies of food in New York City, flow from the Midwest and flow through those states, through Pennsylvania, the distribution centers, and then are furthered on to New York City. So we kind of had to monitor these big flows and, had several key indicators. We were very concerned about tender rejection rates. You'd also have, because of the aging, just the demographic that most truckers are, they felt a lot of them were more at risk because of their age or because of previous health conditions than maybe the general population. So that you'd watch the rejection rates, and you'd have to monitor that. If those started peaking rejection rates to deliver to New York City or to Seattle or to Atlanta, then you kind of have to watch and see if that was going to self-correct, or if that may require some intervention at the federal level to open up one state a little more with their non-pharmaceutical interventions and so forth. And that we tried to feed back to the regional administrators so that they could constantly interact with the governors to ensure that those flows took place.
All right, Gene, thank you so much. Kathy, what about you? Did you have to change any of your policies or procedures and how you delivered information for your members, or how did you have to pivot when this came about?
Well, I'm going to answer that a couple of ways. And actually, the first way I want to talk about it is from the humanitarian perspective and the non-essential. I really, sorry for the DHS folks who may be listening, I hate the terms essential and non-essential, because as a supply chain professional, we design supply chains where everybody's essential, right? So I don't think non-essential exists. But we were able to take some of those industries and some of those folks who may have been a little bit slower, their activities were a little bit slower, and kind of rotate them, pivot them to support the humanitarian community. So we actually saw tons of innovation with this, even business to business mutual aid. So, food away from home restaurant folks who may be driving trucks for some of the restaurant service groups, instead started driving or working in warehouse for a grocery provider, right? So that's an innovation, that's an application outside of normal operating procedure. We were taking advantage of that on the humanitarian side and putting those people to work in supporting the NGO world. The other piece that we started to see from an innovation perspective was redesigned processes and redesigned workspaces. So if you think about things within a supply chain, even just think about the food production facilities, think about going to the grocery store and now there's a plastic shield there, right? So that innovation, that application of technology has been rippling across the supply chain. And that's even moved into the use of robotics, the use of automation, the use of, no touch. I think I mentioned at the top of the call where, transportation is very paper heavy. And that exchange, what the pandemic has done has forced people to innovate and forced people to think of ways to go to touchless, contactless delivery. And we won't even talk about, e-commerce and, I know Dave has, I see the FedEx trucks driving around my neighborhood all day. So I know that, that is innovation as far as just the switch in our supply chains. So I'll pause there.
All right, Kathy, and that's a good segue to Dave. Dave, do you want to share with us some innovations you've had to implement?
Yes, timing's everything. I just tried to send a message to everybody with a link to www.fedex.com/transform. This was perfect timing. FedEx and Microsoft have joined forces to transform commerce. We have FedEx possesses a huge amount of data on supply chain. Routings, delivery, pickup, commodity, customers, and taking that massive amount of data, big data, let's call it that, and using some of the artificial intelligence tools that Microsoft has is going to significantly, that's why I use the name, transform shipping for customers, for anybody. Basically by driving digital illumination of the physical world. If you think about the value of that information, and Gene, you talked about, trying to figure out what you have where it's going, where is it in the distribution network, but taking it infinitely further in forecasting what needs to be where and when. And think about the value of that with the struggle we had with PPE movement around our nation this past year, of some states saying, well, I didn't get what I should have. I got the number of masks I needed, but I didn't get the right number of gowns or footies, or incubators, if you will, or innovators, if you will. Think about the ability to provide near real-time insights down to the granular level of zip codes. And think of it this way, shining a digital light on the progress and movement of physical inventory globally. So we believe that this partnership is going to provide tremendous advantages for not only for us to provide better visibility for us as operators, but it's going to provide a significant value-added piece of data for those customers that we move product for, and we move product for everybody in this conference. So the ability to give you better visibility than what you have now in tracking packages, but think of the small business trying to the value of that type of information in having a better understanding of demand and constraints, and not only the supply chain they rely on to manufacture a finished product, but distribution of what they're creating throughout the global supply chain. So what I'm going to do, Tom, I'm going to send you a link in a separate email to this publicly released piece, but I think it's going to be a significant force multiplier for everybody in supply chain. So that's what we're kicking into innovation for our customers.
All right, Dave, thank you so much. So, Gene, what's next? How are you planning for the weeks ahead?
Laura, was that back to me?
Oh.
Yeah, sorry, that was to you, Gene. Sorry.
Okay. Yeah, I was writing down the www.fedex.com/transformation. So, yeah, I really want to, that sounds very, very fascinating, and I want to get into that, Dave. Appreciate you putting that out. So what's next for us? We at this time of the year, we're really watching the Atlantic and the Pacific. We're looking at when the first hurricane event will occur. And, right now, one of the things that we've one innovation that also leads into what we're looking at now. FEMA is now very closely monitoring our what we call OCONUS, other than continental United States, supply chains to the Caribbean, Puerto Rico, U.S. Virgin Islands, to Hawaii, and our interests out in the CNMI in the Pacific, and also to Alaska. Something that we haven't done in the past, and one of the innovations that we learned to do well during COVID was to monitor those flows, so that if we have an event in any one of those locations, we would be able to see what the impact of that would be to the normal flows for supply chain there. So those are things that we're looking at now. And like I said, we're in the process of renting warehouses and receiving mass quantities of things that people thought they wanted, but they don't want anymore. But some of those will go to build out the strategic national stockpile. And we're going to keep everything warm for if we have a resurgence in the fall and get ready for that. So that's what FEMA is working on right now.
Yeah, send them all to the schools too. They're going to need them, or at least some of them will need them. Jean, thank you. Hey, Kathy, what about you? How is Alan planning for the weeks ahead?
Yeah, I think I mentioned that we're still very much in response mode. We actually had our heaviest number of requests for a single day last week. It was last Thursday when I was trying to take a Friday out of the office. So yay for us. But it's great because it shows that our partners are still out there. They're still working. There's still a lot of need. But we really have to think about how do we, like everybody, how do we continue this pace in a pandemic and another event? So if we have a significant hurricane, how do we feed people, right? How do we shelter people? And I know that states are doing just a tremendous job of planning for all of those things right now. But the supply chain and the logistics partners we work with are going to have to be a huge part of that. So figuring out how do we advise them how to keep their people safe, how to evacuate appropriately, how to do all of those things while still in a pandemic scenario. So it's very much thinking of compound, cascading, large impact events, all of the scary stuff that nobody wants to talk about. At the same time, we're also starting conversations about how do we partner with people to distribute vaccines or other things when they become available, because that planning, building those supply chains has to start happening now. So we're thinking about all of those things. We're initiating those conversations, looking to partners like Healthcare Ready, who are the experts in this space, looking to partners like FedEx on the commercial side, who have just decades of experience doing these things, and certainly with FEMA, who's going to have to help coordinate all of those things. It takes logistics. 80% of any crisis response is about logistics. So that's what we're doing. We're not stopping. We're not slowing down. We're just going to keep plowing ahead.
Good for you, Kathy. Hey, Dave, how about you? How are you planning for the weeks ahead?
Well, my response is going to be a lot simpler. We are going to continue to conservatively move forward in how we protect our team members, our assets, and the supply chain. And the benefit for that for us and for our customers is it will allow us to maintain better control over our own destiny. I remember one of the things, someone shared with me that the chairman told them, our founder and chairman told them, is don't wait for anybody else. That said it all right there. So we're continuing on our pandemic plan. We believe we're in a good position for that. The operation will take care of itself as long as we take care of our team members.
All right, thanks. And Dave, while I have you unmuted, what's the one recommendation you would give the listeners on the line on how they can improve or work on their own resiliency within their organizations?
Well, I kind of alluded to that in the last response.
You did.
Don't wait for others. Drive what you can control. Drive what you can. Well, it's just important to understand. You can only control what you can control. So you have to identify those points first, and then don't wait for others. Drive what you can control to improve your ability to maintain control over your own destiny. I'm not going to discount advice from the CDC and the WHO and the White House, but they don't pay my paycheck. FedEx stockholders do, and the customers I move supply chain for do. So my attitude and our attitude is protect and maintain what we do to take care of the people that own stock in our business, the people that we provide global supply chain services for, and to take care of our team members.
Perfect, Dave. Thank you so much. And Kathy, what would be your one bit of advice to our listeners today?
So I know that we talked a lot about partnerships earlier. That's number one on my list. But number two on my list is a report that was issued by the National Academies of Science and Medicine earlier this year that talks about post-hurricane supply chains, and those lessons are so critical to any crisis. And they've just released an interactive version of that report, which I've put into the chat window. Everybody should read it, because while the audience it was written for was initially FEMA and specifically Gene and the folks at LMD, it has lessons for everyone in how we should be working together to improve outcomes for disaster survivors.
Thank you so much, Kathy. And Gene, I'm going to give the last word to you. What's your bit of advice?
Yeah, I think that, I mean, Dave sounded like a stoic philosopher there for a bit of, control what you can control. And I really appreciate that, because I would look at it this way, that if the federal government does something to help you, then consider that. Don't count on that. Count on what you can control at your level. Prepare. If you can put yourself in a better position to be more resilient from the private sector perspective, I would do that. But at the same time, join these forums like what Dave mentioned, the NBEOC. Great forum. I participate in those as often as possible, and other forums when asked to participate with the federal government. And when you can provide what you're seeing on the ground to us, it helps us to get a better picture and potentially be able to help you either by tearing down some type of barrier or by actually taking an action that can better facilitate your operations on the ground.
All right, Gene, thank you so much. I'd like to say thank you. I'm sitting here watching Dave take a phone call, work on his computer. Gene is checking his device. Kathy's, checking her computer screen while doing this virtual discussion. It just tells us how busy you are and how much we appreciate you spending your time today sharing this great information with us. So Kathy, Dave, and Gene, thank you so much for your time today. And it's not over yet. We're going to ask people to start typing their questions into the Q&A or chat feature. And Tom, if you're still there, I'm going to hand it over to you for a minute.
Thank you, Laura. Great discussion. Dave, love the handball.
Yeah, the Wilson ball.
I haven't seen that since the last time I saw that movie. I don't even remember when that was.
That's awesome.
As Laura said, these are great discussions. I was just making some notes as we were talking here, and there's probably, 4 or 5 other in-depth opportunities to explore. We record all these, right? And we keep this, if you will, it's not in a public forum, it's within the site. You can register for free. It just tells us who you are at seusa.org. We use that as a way to build this community amongst trusted partners, right? We do that because a lot of people, as things grow, they become global, and we get a lot of people that we don't know who they are. And sometimes they ask me for information. I'm like, not sure you should be asking that question. Okay, I know Gene, and Dave, you probably never got those requests, Kathy. So anyway, I want to thank Gene and Kathy and Dave for joining us today. Great discussion. I think we just touched the tip of the iceberg, and from what I gather, it ain't over. My takeaway from today is that Christmas level shipping since January. That's amazing. So yeah. Anyway, Laura, I'll turn it back over to you. We can open up for some questions and dialogue.
Yeah, thanks, Tom. As I mentioned, it's time for Q&A. And before we start taking your questions, I do want to mention that the All Hazards Consortium has our next virtual discussion focusing on communications. with people from CenturyLink, Sprint. We have one other panelist, and that's going to take place on July 27th at 4:30 p.m. So we'll be sure to send you that information, so how to register. And in the meantime, we have some questions coming in. So let's get to it. All right, how do the panelists see trusted data to drive decision-making? Do they have any initiatives to access and use trusted data with so much out there? So whoever wants to grab onto that one.
I think, and I'll take first stab at it here. There's a lot out there to pull data from. I think you need to do your homework on the front end of who's reliable and who's not. And you know I can trust Kathy, I can trust Gene, I can trust Persia. I know Persia's on here somewhere, and Tom, and I think, you know, if you stick with foundational sources like the NBEOC, I think that is a great platform. There's a lot of shared information on there, and I found it to be probably the most valuable portal for me when I need to know something in an event.
Anybody else? Okay, let's move on to our next question. We have a question for Gene. What is the status of FEMA's, and he wasn't sure if he had this acronym correct, the LCMS? Is it useful for a major disaster heavy in supply chain issues as we have now?
I think that LCMS, our supply chain management module that we use, it had to be modified, as I think I alluded to the fact that we ended up moving many different products that we have never stocked or moved or accounted for before. A lot of it to dealing with the testing and all of the things that go with the testing, the swabs and the reagents and so forth. And we also had to add, we had to add SKUs for different types of PPE. We had to make sure that our definitions were correct in the different types of masks. Is it an N95? Is it a KN95? Is it an N99? Is it, is it a surgical grade protective garment? So there was a lot that went into it, and that's not my area specifically. I deal mainly with private sector supply chains and the impacts on response and recovery, but the internal supply chain actions with LCMS, our management system, it had to be modified. Also in the requisitions, early on, we use WebEOC, and I know that people like Persia use those at the state level. With WebEOC, well, we would get a request that would be aggregated with about 20 or 30 different things on it that would have to be disaggregated, and then to make sure that the orders were properly placed. So there was a lot that went on with just using that management system that in a normal disaster may only have 10 different items that it's looking at. Well, now you have 100 items. So yes, the system is working. There's complaints about it like any other supply chain management system, but it continues to evolve.
All right, Gene. Speaking of Persia, she submitted a question to the panel. What would you say are the top 2 or 3 issues or areas to watch as we near the height of the hurricane season?
I'll jump in because I think one of the biggest challenges we're going to be dealing with is the fact that our supply chains are already strained, and the ability to surge from one region to support another region that has been affected by a disaster is not there right now. We have depleted the safety stock in most of our warehouses for lots of different products. And so the ability to surge and support regions is going to be a real challenge. So, normally the private sector is very good about keeping just-in-time inventory plus, but the demand has just outstripped the supply capacity for a lot of things right now. It doesn't mean that we can't catch up. It doesn't mean that there are shortages. There aren't, but it's very tenuous right now.
Yeah. Okay, good. All right, Jean, another question for you from George. Given our experience with COVID, what is our dependency on China for the strategic national stockpile supplies?
Still very much so. We have not totally shifted, and it's economic. So until there is an economic reason for a private entity to produce something here as opposed to China, and we've seen some of that shift a bit, but there's still a lot of the things that we need for both pharmaceuticals and for PPE is still produced in the East. So we built capacity here, but a lot of it is still coming from the East, and I would see it's probably going to stay that way until the economic factors are different that make people drive to opening plants here. But the National Strategic Stockpile is being relooked and is being rejuvenated now. It was definitely not at a level to be able to react to something like this. I think that's quite obvious for many different reasons. So it's all about where we apply our money federally and where the private sector is willing to invest and to change where things are produced. But we're still very much dependent, probably less or so than pre-COVID, but still dependent on the East for a lot of those supplies.
Thanks, Jean. Dave, this may be a question for you, but any panelists can jump in. This is from Kevin. Thank you to the panel. Can you expand, please, on the issue of fatigue for workers and how you manage rotating staff, especially if large numbers of employees are out of work, sick, or under quarantine?
Yeah, we, as part of operating in a safety-sensitive industry, which aviation is, there are duty limitations for that are covered by the Code of Federal Regulations for safety-sensitive positions. Flight crew members, mechanics, aircraft dispatchers, the like. We benchmark with those for other individuals that are not in safety-controlled positions. We have had a significant number of people that have that are telecommuting. I think it's roughly we've only gotten back to about a little less than half of our employees are back to back in the office space. We've got a pause on that at this time, but with COVID has not dramatically impacted our team members very much. So that I hope reflects well on the processes and procedures we put in place as part of our pandemic and influenza response plan. So repetitive coaching, forward coaching of team members to mask up, wash hands number of times a day, but continuing those best practices not only in the workplace, but when they go back home and into the community. It's critical that that they be aware of, and what I mean by fatigue, just the repetitive over and over and over again. We're all experiencing that psychologically, whether you know it or not. The most critical thing to be aware of is the complacency, not being on task with I hate using this stupid term, new reality, and these tested times. And you know what? It's the way life is from here on out. That's my view of it. I think the goal is to try to get people into get it to be part of the routine. what the routine used to be 6 months ago. It's got to be a new routine, something that you just don't think about. It's like buckling your seatbelt when you sit in the car. At least I hope I see a lot of nodding heads there. But Bill, with fatigue in our business, we're always watching for it with team members in critical functional positions. It's a part of human factors and social science. So you just have to be aware of it and address it with an individual that maybe, and you're going to see it in work performance in some cases. One of the things we have done, though, is we have team members in each work group that we task with monitoring workload issues amongst an employee group and redistributing workload amongst the available staff that's on shift. So those are some ways we've addressed it.
Dave, thank you very much. And those were all the written questions that we received, but we're about to unmute everyone's phones if anyone wants to say hello or ask any questions verbally. For those of you who don't or need to go, I just wanted to give you my email address, which is laura.johnson@ahcusa.org, in case you have any questions for me or need any information. Please don't hesitate to reach out to us if you want to do a webinar with the consortium or have any solutions for any of our members. We'd love to hear from you. So right now I'm going to go ahead and stop screen share and start promoting our participants to panelists so that they can ask questions live if they'd like to.
This is the lightning round.
Yeah. Just give me a second.
And we've seen lightning in all definitions of that word.
I'll take typhoons for 500, Tom.
Right, that's right.
So I'm hitting allow to talk. So if anyone wants to say hi when it comes to you, just go ahead and unmute your phone and introduce yourself and let us know you're here.
Hey, Dave, I've got a question for you. I've been on a number of calls that are addressing schools, and school opening, closing, things like that, which then impacts daycare, right? Has FedEx done anything on this front as a major employer? How do you guys are approaching that, or is that hit the main, the main discussion topics yet?
Well, yeah, interesting. That's an excellent question. One of the areas that we are expanding, we have expanding interest in is dependent infrastructure. Infrastructure that we rely on to operate our business. Now, most people, when they think about infrastructure, they think about electrical distribution, potable water, sanitation, fire, firefighting, hospitals. Well, there's education as well. A significant number of our team members are part-time. Let's just say the folks that work in our hub. The vast majority of them are part-time. So we've got 2 operations a day, 1 at night and 1 during the day. And we have looked at how we are going to manage the demand for labor on the day side of our operation, because of if the schools aren't in session, mom and pop are not going to be able to come, pull their part-time shift. So we're looking at innovative ways to address that. That's within our HR, our corporate HR organization right now, who has been working with the county Board of Education, and we're not the only employer that's at risk there. So we are looking at possible solutions for that.
Great, thank you.
Okay, Tom, everyone has been promoted to panelists. So if anyone wants to say hi or ask any live questions, now's your chance. Just unmute your phone and let us know you're here.
Persia, her microphone is still muted.
I knew you were going to pick on her.
She's probably got the phone in one ear and making dinner in the other hand, right?
Yeah. I'll say, hey, Bruce, how are you? They're being quiet today, Tom.
Unbelievable.
Laura, can you hear me okay?
Hey, George. Yeah.
Great. This is a question for Dave and Kathy, mostly. If a vaccine does come out, hopefully in the not too distant future, do you see that being mandatory for your employees? And if they decide not to get a vaccine, what would be the other measures that you would want them to do?
Well, speaking for FedEx, you get involved in HIPAA there, and we're not going to tell somebody they have to get a vaccine. That's not our area of responsibility.
This is Jeff. That HIPAA doesn't have anything to do with that, and you probably aren't a covered entity. But as a private employer, you can establish whatever guidelines and standards you want for people to work there. Healthcare providers do that all the time.
Thanks, Jeff.
I'll let the employment law people take care of that. Good man knows his limitations.
Hey, Laura, Tom, just wanted to say hi and great panel today, great information. Thanks, guys, for taking the time to do this.
Hey, Bruce, good to see you again.
Yep.
Persia says she couldn't get off mute for some reason. That could be the same with a few others. But last chance to say hi if anyone has any questions.
Hi, can you hear me?
Yeah, hey, Craig.
Hi, Craig Tanaka from Maui, Hawaii.
Aloha.
I'm sorry. Aloha. I'm sorry. I was on another call, so I had both running at the same time, and I wasn't able to listen in on a lot of it. So my question might not have relevance or maybe redundant, but in the hospitality industry or any industry here in Hawaii, there's a lot of mandates about travel, having to provide a negative PCR test as you come into the state and so forth, and that's being evaluated right now. But what is the legality, or if you can provide guidelines on a hotel, resort, a condominium requiring to provide or have proof of those documents, before coming into the property or into the hotel? Is that something that's, I don't know if businesses are doing that over in the continental United States and what that process looks like?
This is Dave. I'll respond that, we ran into something similar to that back in the spring where we had businesses where we had couriers or FedEx team members making deliveries to that were presenting them with questionnaires and forms to fill out. Have you been, where have you been? Have you done this, done that? And we had our employment law and HR people create a form that was not a risk for us as an employer or the employee, that they were able to take with them as an official FedEx document that addressed in general the concerns that the WHO, based on what the WHO and the CDC were providing publicly. So I'm old enough to remember when I had to travel internationally, I had to carry a vaccine card, a yellow card, I believe. That may be in our future. Just a thought.
Great, thank you.
Thank you. All right, last chance. Well, it's a few minutes after 6, so I think we will adjourn. But before we do, just want to say thank you again to our panelists. We got a lot of great feedback on the chat. Hopefully you had a chance to read that and just how much people appreciated your answers and your input. So thanks to all of you, and thanks for everyone for attending. I hope you got some valuable information out of it, and we hope to see you next time. Thanks again, and stay safe, everyone.
Thanks, everybody.
Thank you.
Thanks.